Okay, mahalo nui for everyone for joining us today. We'll go ahead and open up our space, maybe with some hanumai and hanu aku, some breathing to center and ground ourselves today for the ike we are about to listen to. So if we can hanumai, breathe in, hanu aku, breathe out. Hanumai, breathe in, hanu aku, breathe out. Hanumai, hanu aku. E ho mai ka ike mai luna mai e. O na mea huna no eo. O na mele. E ho mai. E ho mai. E ho mai e. Ho mai ka ike mai luna mai e. O na mea huna no eo, o na mele. E ho mai, e ho mai, e ho mai e. Ho mai ka ike mai luna mai e. O na mea huna no eo, o na mele. E ho mai, e ho mai, e ho mai e. Oh yeah. Okay. Aloha nui kako. Mahalo nui everyone for joining us today. Can you all see my screen? Awesome. Perfect. Mahalo. Okay. So, aloha nui. My name is Kealaokekoa, and I am the project manager with the Ohana Center of Excellence. So, mahalo nui to everyone for again joining with us today for today's workshop, which is called Kealaokekoa, a cultural journey of rediscovery and self-reliance for substance use disorder treatment. Well, I can't read my notes; too small. Okay. So the Ohana Center of Excellence, just to give you a little bit of background on us, we are a resource for empowerment, education, and support for individuals as well as organizations that are seeking behavioral health care guidance or including mental health and substance use resources in the work that they do. And so whether you are a community member or someone in the field of behavioral health that serves our Asian American, Native Hawaiian, or Pacific Islander communities, we hope to kokua or to help you, to help all of those that are looking for culturally tailored training and resources. So our resources are rooted in culture, language, and indigenous knowledge. And we understand that all of our Asian American, Native Hawaiian, and Pacific Islander communities are incredibly different and diverse. So our resources really aim to reflect that diversity and to uplift the strengths that are in each of our cultures. So our Ohana Center of Excellence is funded by the Substance Abuse and Mental Health Services Administration, which is called SAMHSA for short. And it's coordinated by the Hawaii State Department of Health, Adult Mental Health Division, in partnership with California State University East Bay, Papualalokahi, the native, and San Jose State University. And so I work with Papualalokahi. I'm a program coordinator for our substance use and mental health projects under Papualalokahi, which is the Native Hawaiian Health Board. So what does all that mean, right? So just to give you a little bit of background on the actual things that we provide through the Center of Excellence, as a partner of the Center of Excellence, we provide training and technical assistance. Oh, I think I'm supposed to advance these slides. There we go. We provide training and technical assistance for those who are working in those fields of substance use, behavioral, mental health, and all who serve the needs of Asian American, Native Hawaiian, and Pacific Islander communities. We have ever-growing resource libraries that are available on our website. You can see on the screen there, it's aanhpi-ohana.org. Go check them out. Where you can explore resources by location. In your location, we have a service area of the entire country, Hawaii, Alaska, as well as the U.S. affiliated Pacific Islands. So you can explore those resources by location, by topic, and we even have downloadable tools. And then we host an array of free learning opportunities like this one all throughout the year. Each topic is unique and designed to expand your knowledge of how people in the behavioral health industry can best serve our AA and HPI communities. So we have a network of regional steering committees, again, that spans our service area, and people that represent our diverse AA and HPI communities, who all guide our work by helping us to best understand the diverse needs of each of these communities all throughout our country and the U.S. affiliated Pacific Islands and territories. And we continue to grow this network. So if you're interested in joining a steering committee, please visit our website, and then under the contact menu, you can fill out an interest form for a lot of different things, actually. We also send regular emails and maintain a community corner on our website that shares all the latest from behavioral health communities all across the country. If you are on social media also, please follow us, and we do follow back. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. So you can find links to everything mentioned on our website, as well as on the screen. Let me go back. So first, before we dive into our today's presenters, I want to go over just a few housekeeping about our Zoom webinar space. So our session today will be recorded, and with the exception of any breakout sessions that we may have. So if you want to share the workshop with any of your colleagues afterwards or anyone in your community, the replay will be available on our website in a few days. Please note as well that we're using Zoom. I believe we're in Zoom webinar today. So you do not have the ability to turn on your camera and mic, but if we do just need to go in, I wasn't sure if we're actually using breakout sessions today, but the chat is activated, and we'll go ahead and monitor that throughout the session. We'll put any questions in the Q&A section, and we will bring it to the presenter's attention. At the end, we'll leave some time for question and answer. And then after the workshop is finished, you'll receive a follow-up email with a link to a survey. And then we'll also supply that link in the chat. And we're conducting this survey really to help us better understand how we can meet your needs and what was most useful for you about this workshop, on what you want to see in the future as well. It should take you about 10 to 15 minutes after the workshop, and we'll put that link in there as well. We also are offering continuing education credits today for social workers and addiction certifications. So we'll go ahead and put that attendance verification in the link at the end as well that you can fill out, and we'll send you your credit letter. We do ask that folks, these continuing education credits are approved by our Hawaii chapters of our National Association of Social Workers and our Hawaii State Department of Health. So please make sure that if you are in another area, that you do check with your local credentialing requirements, that they will accept these credits. Okay, now that all that is out of the way, we'll go in to share a little bit about today's presenters, and then I'll hand things over to them. So today's presenters are Nikki Wright and Makani Tabura. Nikki Wright is the director at the Waianae Coast Comprehensive Health Center, overseeing both the Malama Recovery Services in intensive outpatient substance use disorder treatment program at the Ho'okuola Hale's Integrated Chronic Pain Management Department. She is licensed as a clinical psychologist and certified as a substance abuse counselor in the state of Hawaii, and has made it her mission to reduce the negative social stigma surrounding mental illness, in particular substance use disorder, and to break down the barriers that prevent individuals from accessing the care they need, particularly in medically underserved communities. Dr. Wright's interests are focused on health psychology and working with diverse and marginalized populations, including chronic pain management, trauma systems, and women's health. She is also the Chief Behavioral Officer at the Wahiawa Center for Community Health, co-founder of Imoa Health Group, and clinical psychologist for the State of Hawaii's Department of Education. And Dr. Wright has previously taught in the Rehabilitation Counseling Master's Program at the University of Hawaii at Manoa under the Department of Kinesiology. In her personal life, Dr. Red is a National Health Service Corps ambassador committed to improving access to primary care in underserved areas of the United States through her impressive work and unwavering commitment to improving mental health and well-being. Um, Whoa, I lost my place. Unwavering through her unwavering commitment and to improving mental health and well-being, Dr. Wright has made a significant impact on the mental health and well-being of her patients and communities, and continues to be a leading voice in her field. And then our second presenter, don't you just love it when your eyes they're like squirrel and then go to something else? Okay. Makani Tapura was raised with three brothers by his mother and grandparents on their tiny family farm on the island of Lanai. From a young age, he was instilled with a deep understanding of the importance of culture, connection to a higher power, Akua, the land, Aina, and the people, Napo Kanaka. During high school and college, Makani mentored and worked with at-risk youth at his mother's youth center on Lanai, as well as with the local and national organizations such as Napuana'yao Pacific American Foundation and the Native Hawaiian Education Association. He shared his cultural knowledge and taught concepts of traditional cultural beliefs in health, wellness, and fitness. Combining his grandmother's teachings as a nurse and cultural practitioner, Makani studies in exercise science, hula, and health and wellness from Hawaii College of Health and Sciences. Makani created cultural activities, programs, and curriculum for various hotels and resorts throughout Hawaii. He developed the first Hawaiian-based health and fitness programs for the Hilton Hawaiian Village, Haleakua Hotel, and Sheraton Resorts. Currently, Makani is the Director of Cultural Education and Activities and a cultural practitioner at the Waianae Coast Comprehensive Health Center, specifically within Ho'okuola Hale and Malama Recovery Services. He is also the Po'o, or Director of the Kako'o Council at the Kalaniho Okaha Traditional Hawaiian Healing Center. Makani has developed a successful culturally based addiction recovery curriculum, and he prides himself on ensuring that everything he does personally and professionally is culturally based and balanced with the traditional knowledge and Western practices. Makani's primary responsibility, gifted to him by his kupuna ancestors, is to preserve, perpetuate, and practice traditional Native health, wellness, and healing to improve the lives of his family and community. So mahalo nui to you both, and I'm going to go ahead and turn things over to you.
And thank you for coming.
Yeah. Good afternoon, everyone. I love starting my afternoon with Oli. That was absolutely beautiful, Lilinoy. Makani and I wanted to start by sending our biggest thanks to Lilinoy, Papa Ololokahi, and the entire Ohana Center of Excellence for inviting us here today to share how we integrate cultural concepts and practices into our traditional medical services. Like Lilinoy reviewed in that, I didn't realize how long our bios were going to be. We work for Waianae Coast Comprehensive Health Center, the oldest and largest of the federally qualified health centers in our state. And Makani and I work for two different clinical departments, specifically Malama Recovery Services and Ho'okuola Hale. Even though we work for the health center, we did want to start by clarifying that the opinions and viewpoints expressed in our presentation today are solely those of Makani and myself and do not necessarily reflect the beliefs or official stance of the entire health center. The content we will be sharing is intended for informational purposes only and should not be construed as representing the collective views of the health center as a whole. We are so honored to be able to share with you today our current programs and the work that we've done over the last few decades. None of the information we're going to present today is actually probably going to be new for any of you, but what we do hope is that you will take away some ideas about how you can incorporate culture as a healing practice into your current services to improve your positive long-term outcomes. So I'm going to ask my assistant, Craig, that I met 30 minutes ago, to share our slides. Thank you, Craig. So Waianae Coast, if you can advance the slide, Comprehensive Health Center was opened in 1972. And in the early 1990s, our kupuna in our community started approaching our executive leadership team, and they started asking for help to address the growing addiction issues on our leeward coast. So we were seeing higher rates of homelessness, incarceration, physical and mental health problems, and of course, family issues. We were seeing a lot of grandparents hanaiing and raising their grandchildren because their children were using drugs and not at home to care for their own kids. So in 1994, our health center opened Malama Recovery Services to address the growing treatment needs of our community. On our next slide, it's a picture of our beautiful main campus across from some of the most beautiful beaches in the whole state, maybe even the whole world. Of course, we're a little biased because we get to work in this beautiful space every single day. And yet on the next slide, we're going to see how we treat some of the sickest residents in our whole state. Our whole service area is comprised of almost 50,000 residents with some of the highest rates of heart disease, hypertension, diabetes, cancer, lung issues, kidney disease, and obesity in the state. In large part, we think this is due to the complex social determinants of health in our community. For example, we have the lowest average per capita income in our whole county, with over half of our kiddos receiving some type of public financial assistance. Our infant mortality rate is the highest in our county and second highest in our state, which is another huge tragedy that underscores the significant issues in our community. Now, on the next slide, we're going to look at some substance use issues in our whole state. I tried to pull the most recent statistics from the state websites, but it does take a while to collect, compile, and analyze data. So we don't yet have the 2023 stats available to us yet. But if we look in this slide, between 2018 to 2022, there were 67,879 emergency room discharges related to mood-altering substance use. On the right hand of the slide, I have a breakdown here of the types of mood-altering substances associated with these ER visits. As you can see from this slide, it's alcohol, nicotine, that was a little surprising to me, and stimulants are among the top three substances, followed closely by marijuana. And then again, on the bottom left, we see 248 overdose deaths in 2021. And the vast majority of these deaths are related to opioid overdoses. On the next slide, I have the top reasons that adults were admitted to treatment in 2022 in Hawaii. As you can see, methamphetamine, marijuana, and alcohol are the top three drugs, which has been relatively consistent, I would say, in the last 2 decades that I've been working in the addiction treatment field. However, Makani and I are starting to see a shift with more people coming in for treatment abusing opioids like heroin and or prescription pain medication. I myself started working in Malama Recovery Services in 2005 as a resident. Wow, I'm really dating myself there. And when I got licensed in 2008, I was promoted to clinical supervisor. And then I was promoted again in 2010 to the position of director. But in 2008, when I became the clinical supervisor, my team at that time approached me and they asked me, how can we be doing better for our haumana, our patients? They talked to me about this pattern, this revolving door that they saw where our patients would graduate from treatment, then return months or even sometimes years later for more treatment. And they often had worse physical health, mental health, and legal issues, among other things. So we started to collect some data, and I wanted to compare our data to the state and national statistics. What we found in 2008 was that our stats actually mirrored the state and national statistics, where within 12 months of completing an outpatient program, 87% of patients relapsed on mood-altering substances. Those were actually considered pretty good stats at that time. The 12-month period was not an arbitrary number. It's actually how the federal government defines long-term recovery, or another term that you frequently hear is sustained recovery from the American Psychiatric Association. So even though at that time, on paper, we looked like we were doing pretty okay because we were on par with state and national statistics, my team wanted to do better for our community. I mean, that's only 13% of our clients were able to sustain long-term recovery 12 months after completing our program. So what we did is we decided to look closer at our patient population, first of all, and we saw that our Hamana at that time looked very similar to the statistics on this slide. So the vast majority of our patients were reporting methamphetamine as their primary drug of choice, followed by cannabis and alcohol, and then sometimes a combination of two or more polysubstance use. So we shifted our curriculum at that time to a cognitive behavioral curriculum specifically empirically validated to treat stimulant use disorder. So that was our first strategy. The second thing we did was we advocated to our executive leadership team to transfer from an insurance-based program to an individual-based program. So, of course, that meant more money because essentially what we did is instead of determining how many sessions a client would have based on their insurance benefits, we felt like even if somebody's sessions ran out, if they weren't at a stable place or we didn't feel they were able to maintain their recovery independently, we were going to keep providing them with free treatment until they got to that space. The last thing I did was I looked at our best practices for patient to counselor ratios, and I advocated to my executive leadership team to limit my counselors' caseloads to 12 to 14, which was in line with national best practices, so that each of our Haumana received the individualized attention and support that they needed and deserved. Within 7 short years, and I can say that now because I've been there almost 2 decades now. So within 7 short years, our stats increased from 13% of our patients maintaining long-term recovery, which was 12 months post-graduation from our program, to 64% of our patients maintaining long-term recovery 12 months post-graduation. Now, our team was obviously very excited and encouraged by these statistics. However, if you can't tell over video, I'm Asian and I'm also a huge overachiever. So I looked at that 64% and I thought, oh my gosh, that's like a D grade. We have to be doing better for our Haumana. It just so happened at that time, my path crossed paths with Makani Tabura. I like to call it destiny or fate. I know some people don't believe in destiny or fate. They believe that we create our own destiny or fate. Whatever you call it, Makani was hired in around 2015 to create some cultural programs for our health center in a whole different department. When I heard about his background, I asked him for a meeting and I described our program and the work that we had done so far, and also the additional struggles of our Haumana and our whole community. And I begged him to pretty much design and implement a cultural component to our current program. I gave him free agency to create whatever he wanted for the curriculum. And the only thing I asked him was, you just let me know how much anything might cost associated with developing this program. Sorry, I'm recovering from the flu. I think I gave him a couple months, and then within 5 years, he created the program and he made different iterations of it. Our 64% of clients who achieved long-term recovery 12 months post-graduation after completing our program grew to 88% of our Haumana sustaining long-term recovery for at least 12 months, a lot of our Haumana a lot longer after completing our program and adding the cultural component to our curriculum. Our clients, on an also happy side note, also reported no new legal charges and no new CPS reports after they completed our program with that cultural curriculum component. I do want to insert the caveat here that this is pre-pandemic statistics. Since March 2020, we have had to postpone some of the less essential duties, and we've pretty much been in crisis mode, just like the rest of the country. All hands on deck since the COVID-19 pandemic. We decided as a team to prioritize direct patient care at that time. So we did not have to shut down even for one day any of our services. And we made sure that all of our patients received their essential services throughout the pandemic. Now that things are settling down a little, we are going to probably start collecting outcome measures again. And then we'll see what effect the pandemic had on our program participants. Now, While we were working together and designing cool programs and helping thousands of patients and their families since we opened in 1994, of course, the drug trends in the nation and state were still happening all around us. One way that our health center attempted to address the opioid crisis that swept across the nation and started to impact our state was to create an integrated chronic pain management department. We were able to open our current clinic on the next slide with a generous initial grant from HMSA in 2017. Our pain program started as a pilot project during the initial 2-year funding period. And on the next slide, you're going to see that our initial cohort included 1,488 unduplicated patients, and we provided over 15,000 encounters, both in person and through telehealth, across all of our different disciplines. Makani and I actually do a whole different presentation where we go over the infrastructure, the workflows, and some of the services of our chronic pain management program. We also discuss a lot of the successes we've had since 2017. A few things I wanted to mention here today is that we were recognized by HRSA as a promising practice in chronic pain management just a couple years after we opened. But I think our biggest success is that we have had 0 opioid overdose deaths in our program since we opened our doors in 2017. So on our next slide, you're going to see that a huge part of our success was the integration of cultural education activities and practices into our medical services. Oh my gosh, Makani, look at that picture. We both had more hair and we had less weight. Whew. That was 2018, a year after we opened our program. So our 2 fabulous cultural educators are part of every single clinical treatment team meeting to offer their mana'o and contribute to our treatment planning process. We also made sure that Makani and Kekupu, our other cultural educator, were also there for every step of our program development to provide consultation and recommendations to ensure that we implemented culturally relevant interventions and services in everything we do as a pain management team. I know that we're not the only program that are implementing cultural education and practices, because on the next slide, you're going to see in 2022, Aloha Care was the first insurance payer to cover Native Hawaiian healing practices in Hawaii. And now other insurance payers are looking to do the same. I just don't want to rely on our statistics, though, to determine the strengths and weaknesses of our programs. To me, as an administrator, I feel like the best measure of our success come directly from feedback from our haumana themselves. So I've been collecting some feedback over the years from our haumana, and I wanted to share a couple quotes on the next slide with you here today. This is from program participants from both of our programs. Oh my gosh, it's pretty small. Let me see if I can read it. This one haumana said, "I was empty. Something was missing inside me until I figured out who I am and where I came from in culture class." Another of our participants said, "Makani and Kupu showed me there's a different way to live my life." And I love that Makani and Kupu are not just teachers in the program. They really take ownership and they're amazing role models to all of our clients. I love this one. This participant said, "Fear is not an effective motivator." And I think there's a lot of fear that initially drive people to come into treatment, like fear of getting violated and going back to jail, or fear of losing their family, or fear of losing their home or their jobs. So I love that Makani and Kupu, they utilize aloha and forgiveness and unconditional positive regard as a way to affect long-term change, not just the short-term change that we see when fear is the motivator for that change. Another client said, "My kumu is someone I can talk to." I have a couple more quotes on the next slide. "My kumu talked to my girl." All of us in the treatment space, we know that addiction is not an individual problem. It really is a systemic issue. So Makani and Kupu make sure to involve anybody who the person considers as part of their ohana, not just blood relatives, but even Hanai family members and members of the community. And to us, that's the only way that treatment's going to work. "My kumu believes in me. He gave me hope." And then my favorite, I saved for last, "Learning about my culture makes me feel better." There are just so many benefits, I think, to incorporating cultural education activities and practices into your medical, clinical, and support services. I listed a couple of those at the bottom of this slide, but I think this last quote really summarizes the best benefit, which is essentially culture is healing. There are definitely cost-effective ways to expand your current services to include cultural education and activities without breaking the bank. So without further ado, it is my pleasure to introduce our lead cultural educator, Mr. Makani Tabura, to talk about some of those integration strategies. He is someone who has reinforced to me over the years that the opposite of addiction is not sobriety. The opposite of addiction is connection. Makani?
Umai kia nue nue bioi dale ka auna manui tahiti I kane a ke keiki maku ai alohai alohai alohai. Aloha mai kako, mahalo, 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 Dr. Wright. I just want to start with this, since we're fresh on this topic. In order for this to work, is not only it's relationship, but we have to, in order for us to move forward in this field of health and healing, the cultural practitioner, the medical provider, we have to find ways to work together. I grew up in a time where my kupuna, my teachers, and my kumu were saying, no, we do what we do and they do what they do. We don't mingle. We have to. So with that said, seek out medical providers, seek out cultural practitioners, seek out medical providers, and let's figure out a way to get back to any ethnic group, any cultural group. We were all forward thinkers. So it's all about the relationship. We want to get right into it. I want to kind of go first, this slide. We talked about whole ku'olo pain management. One of the things we learned before we get into substance abuse disorder is that growing up in Western society, we have lost our ability to we stress out. We stress out. We have all these anxieties, and we lost our ability to express that and get rid of it. So, if you could go to the next slide, we as healers, one of the first things we were taught is number one is assume no one is sick or ma'i. I will never assume anybody is sick. The next thing I was taught was that when that happens, we look at the person as a whole. We look at them physically, mentally, and spiritually. Something we have to add to this now is environmentally. A lot of times we are a product of our environment. A lot of our stresses, a lot of that. So especially as a Native Hawaiian, if we are connected directly to our land, why are we not using our land to heal us? So physically, mentally, spiritually, and environmentally is how I look at all of our haumana, our patients and our clients. And it sounds really weird because I will look at somebody with a sprained ankle the same way I will look at somebody with an addiction disorder. All I know is that their energy, their frequency, and their mana is weak. And that is my focus. So if we can go to the next slide. We know as Native Hawaiians, and I'm going to use the term Native Hawaiian a lot, but I want you to keep in mind, whether you're Native Hawaiian or not, I want you to look at your ethnicity and your cultural background. I was taught Native Hawaiian approaches, so think about ask yourself this question: what did my ancestors do? As Native Hawaiians, we're very healthy people. We strive for Mauliola, which is the upper echelon of health, wellness, and healing, right? Early Hawaiians, everything we did was physical, whether it was surfing, whether it was hula, or we just got out of makahiki season. The brilliance of our Hawaiian people knew that if 8 months out of the year we're going to be warring and we're going to be fighting, hey, 4 months of makahiki, it's time to, as I like to say, control, alt, delete our lives and let's figure something out of how to make ourselves better. from the illness or the injuries that we may have sustained for the 8 months out of that year. If you move to the next slide. A lot of times people ask me when I create curriculum, how do we know? How did we know Hawaiians had anxiety? How do we know we had stress? How do we know we had problems? We did. And as they do on the Western side, they research, and we do the same. If you look at our old hula, our oli, our chants, a lot of different things, you find evidence. There were times, for example, those of you that understand hula, and if you don't understand hula, there's a chant in a hula, Waipio Paka Alana. The second verse is Heloha Kawahine Pi'ika Pali Puliana Ika Hua Ule, a story of a chiefess who married her cousin, a king. Short story long, marriage went bad, and she, for lack of a better word, she lost her mind. She went crazy, put her child on her back and swam to the island. And it got to a point where she got so bad, she was climbing the cliff sides. Pi'i kapali, climbing the cliff sides. Huiliana ika hua ule. As she's climbing the cliff sides, she's eating the ule berries. So within her stress and her trauma of marriage and what was going on, she knew, let me eat these ule berries to make me better. But now I want you to see her husband repented, and it says, in kind treatment, she regained her reason, and the family was happily reunited. The focus on that is in kind treatment. So when Dr. Wright talked about fear, and our Haumana said fear is not a motivating factor, we have to teach them and treat them with kind treatment, with aloha. So we have evidence in the old days that we did have these kind of stresses, that we did have these problems. If you can go to the next slide. So a lot of people will ask, how do we know? We also have more evidence. We had vahipana, we had sacred places of healing. For example, Kapai Mahu in Waikiki. A lot of people, thousands of visitors walk to Waikiki, through Waikiki, and they have no idea the seat of healing is right there. So we had these sacred places all over the Pai'aina, all over the state of Hawaii, all over the kingdom of Hawaii, that is evidence that we had places for healing and health and wellness. If you can move to the next slide. Now, what we teach our haumana, again, we've lost, especially for men, we've lost this ability to talk about our feelings and to get rid of these feelings. But what's most important is to have them understand what types of stress and what types of kaumaha that they have. Go over it really quickly. There's different types. Kaumaha is a heavy weight, a heaviness. Could be physically, could be emotionally, that's bearing down on a person. So there's different types of stresses. For example, there's that iha, which is we always use for pain, is expressed as a form of sadness associated specifically with relationships. As we say, the agony of the heart is love. Different types of stresses that we have them understand. Another form of depression expressed as a state of being contaminated, damaged, or deeply troubled. A lot of times this depression is more associated with one's spirit or their soul. And this is the most important part. This type of sadness, it's a result of one feeling disconnected from their gods, from their culture, from their family, and from their church community. This one, a lot of times, is what's going on with a lot of our haumana in addiction. They're disconnected somehow in a way. So we try and teach them the differences in feelings, the differences in stress and emotion that they have. So now they can identify how they're feeling and what we can do to heal that. Next slide, please. And of course, there's various ways that we use, and we'll just go through them real quickly. Of course, lomi lomi. As most of us know, is a type of, for lack of a better word, massage. But I was taught it's more of an alignment of mental, spiritual, and physical being. Next slide, please. Also, la'au lapa'au, plant medicines, healing medicines. Specifically in stress and anxiety, there's a few that I thought of that I was taught. We have ava. Most of you know ava. If you don't know, it's used to treat a wide variety of ailments. 6 different chemicals are found in the ava root. And these chemicals and these components differ in the physiological effect, including relaxed mental and physical state, improved ability to think, and the stabilization of feelings. And I have to say this, Native Hawaiians were the only society in the Pacific that didn't use ava for recreational purposes. We used them strictly for ceremony and medicine, right? We also have olena. We talked about the oli earlier, ule. Ule was used to treat ea and pa'au'au, which is kind of a ancient term for a sickness. The leaf buds and the seeds of the ule are eaten until the illness is gone. So again, we go back to that chant about this woman within her anxiety and being distraught. She still knew that by eating this ule, you do it until the illness is gone. Haui is another one we have all over here in Waianae. Haui, the leaves and the stems and the flowers, used as a poultice for external application like cuts and bruises, but what we use it for also is to make a tea for anxiety and stress. Next slide, please. We also had physical practices we used in stress and in pain management. Hi'uvai, kapukai, pikai. You've heard these terms before. They all differ a little, but the same medium is water. Is water is vai, fresh water, or kai, ocean water. A lot of times we do this with our haumana. Whenever you're going to treat someone, you have to prepare the body. You have to prepare them mentally, spiritually, and physically. So we use these practices, and for lack of a better analogy, I like to say it's a Control-Alt-Delete, if you will. Different practices that we can use within the water and the ocean. Next slide, please. And of course, oli. We hear oli a lot, chanting, for lack of a better word. But oli, I was fortunate enough to learn oli, not just for hula, not just for mo'oku auhau and genealogy, but oli is very, very good in healing practices. The vibrations and frequencies that is created through oli. We know, and I was taught, when somebody is a ma'i, their frequency and their vibration is unbalanced. Oli is a perfect way to rebalance somebody before we administer any kind of health and wellness practices on them. Next slide, please. Okay, you can go to the next one. Now, this is what I want to get into, probably one of the most important parts of this webinar. Kealaokekoa. We want to get into addiction therapy that we've created. Again, I have to thank Dr. Wright for reaching out in this collaboration. It took me a while. What she did basically says, she asked me the question, what did Hawaiians do in time of crisis in addiction? Which really, as a traditional Hawaiian healer, I really thought about it. You know, we had ailments back in the day, but in Western society and contemporary world, we have these new ailments and these new pilikia. So I really tried to do some research, and I wanted to look at how and what can we utilize as far as cultural practices go that we can use to help in this field of addiction therapy. Moving to the next slide. So a cultural approach to substance use disorder treatments, practices, concepts, and values. So these are just a handful of things that I thought of and I created, and I really had to do some research with. One of the first things I want to tell you is that, like I said earlier, as a traditional Hawaiian healer, the first thing I was told was you never assume people are ma'i. Never assume there's anything wrong with anyone. So words, as we know, are very important. The name of our program, Kealaokekoa. The reason why we chose that is because addiction is going to be the most unbelievable fight anyone has ever gone through. It doesn't matter if they fought physically the biggest person in their lives. Addiction is going to be their most difficult fight. And to conquer addiction, you have to be on this path as a warrior. And so we call them, we don't call them addicts. We don't call them users. We never put them down. To me, they're warriors. They are koa. So some of the things we use in cultural approaches to SUD treatment, vahipana. Vahipana is sacred places. The reason why we use vahipana is one of the things that we found in our research and working with our haumana is that there's a disconnect from culture. And as we know, as local people, when we meet, we don't even ask your name. The first thing we ask is, hey, where are you from? So we teach them vahipana and the importance of sacred and storied and legendary places. And we talk about where they are from because they are representing. What we teach them is that, whether say you're from Waianae, when we meet somebody, I meet Dr. Wright, I say, hey, where are you from? She's going to say, oh, I'm from here. So 4 main things we teach them: moku, ahupua'a, kuleana, and ili. Those 4 main components of their vahipana: their state or their island, their district or town, their neighborhood, and the house they grew up in. A lot of times you see them, they have no idea. Those 4 things is automatically they represent. That's why we always say where I'm from, where, people in Nanakuli, oh, I'm from the west side. We're in Nanakuli. Oh, 3rd Road, the house right behind the fire station. That's how and so when you say all those things, you have to reconnect them to where they're from. So vahipana is very important. Other things we utilize right after that, Ike ho'omau popo ai ponoi. Simply, who am I? Again, we realized through working with these haumana, there's a disconnect, not only from their land, but there's a disconnect from their ohana and who they are. You ask any of your haumana, anyone that you work with substance abuse disorder, they can tell you at one point in the height of their addiction, they did not know who they were. So we reconnect them to who they were, and we simply do it with mo'okuauhau, your last name, your middle name, and your first name. As we tell them, those 3 names, your parents gave you those names. That is your roadmap. That is your life instruction manual. Before you were born, you have a last name that you didn't choose. Already, you had kuleana and responsibility before you were born. When a baby is born, they say, oh, that Tabora baby, they're going to be like this, or they're going to be like that. So that is their roadmap. Our parents gave us names, but I hate to say that our parents failed. They just weren't very they didn't communicate with us. If they gave me the name Makani Ho'olana Ihale, and I had no idea what that meant, then I don't know who I am. So we reconnect them to who they are. Other practices we use, of course, mo'okuauhau, their genealogy. And a lot of times you will see and you will experience that somehow mana, they don't like their family. They don't like who they grew up with, which is totally fine. What we do is we share with them, it's okay. As some of you Native Hawaiians know, we were famous for changing our names. The reason why, and I tell them, I said, even on a larger scale, when immigrants came to America, when they went to Ellis Island, when they went to New York, one of the first things they did was change their name. One of the reasons why is because changing their name changed their whole trajectory of their life. They wanted to be better. So we teach them, it's okay to change your name if that was a name that you didn't like, right? So we teach them to create their own or their new mo'okuauhau, their new genealogy. Another thing we use, hana no eau, and we like to take them and give them a break from using their minds. Hana no eau, traditional arts and crafts. We teach them a few different things that we'll get into in the next few slides. Oli we talked about. We use oli, and one specific oli that we use is e iho ana o luna, e pi'i ana o lalo, e hui ana na moku, e ku ana kapaia. Everything that is above will come down and everything that below will come up. We will unite as islands and we build this rock wall, this stone wall of safety around us. In the addiction world, a lot of our haumana, at one point, people put themselves above them. At one point, they felt at the lowest in their life. So everything that is above will come down, everything that below will come up. We give them the skills, we will unite, we have to come together as islands, as moku, and how we protect ourselves. Huana Kapayas build this wall. So we teach them different oli. Now we teach them oli not to teach oli, but to use it as a healing practice. We also use hula, we use kilo mahina, and haku mo'olelo. If you can go to the next slide, we'll get a little bit more into it. Now I want to share with you 3 words that we teach our haumana. 3 very important words. If they do not understand these words, if they do not implement these words into their life, then it's going to be a difficult fight to conquer addiction. Oya i'o. You have to be absolutely truthful with yourself. A lot of times, as we know, they will tell us till they're blue in the face, I don't have a problem. Drugs is not my problem. They have to be honest with themselves. Once they're honest with themselves, we teach them to mihi, to forgive themselves first, and then forgive those around them for thinking less of them. And the last word is kala, to release, to unbind, to untie, and to let themselves go. Let that pilikia go. Without those 3 words implemented into their therapy, then it's going to be a difficult go. If you can move on to the next slide. So we talked about vahipana, the 4 things that is important. Moku, ahupua, kulian, and ili. What I want to add to this, now a lot of times, they may not get out of our program in 12 weeks. They may come back. So a lot of people ask, well, they already did their vahipana. Now what? Well, their vahipana is always going to be evolving. So if they happen to relapse and they come back to the program, we add to their vahipana, what is your mauna and what is your kahakai, right? Who do they represent? What mauna do they represent? What beach do they represent? We also teach them when they're having a bad day, when they're having stress and anxiety, what 2 places can you go to get away from just the world, is the mauna or the kahakai? If you move to the next slide. Kilo mahina is one of the things we recently added to our program. I truly believe in Kilo mahina and in observation, studying of the moon. And a lot of our haumana, they don't realize the difference with a horoscope and a mahina, but we really try and teach them to Kilo mahina. That is another way that gives them a roadmap to their life and helps them on a daily basis. I always tell them you have 29 and a half moon phases to get your month right. If we can move to the next slide. So as we know, Hawaiian moon phases, are 12 Hawaiian lunar months. So we try and teach them, we get them into a practice of observing the moon on a daily basis. So at the end of the day, when they don't have anyone to talk to, their alternative, their sponsor, they always have Hina. They always have Hina to give them advice, the moon to give them advice on how to lead their life and what to do to prepare for their lives. If you can move to the next slide. Some examples of Mahina, the moon calendar, moving through each of these phases contributed to our daily lives in a myriad of ways: physical, mental, spiritual, and environmental. Our survival is linked to earth, sea, and sky. For the most part, a lot of us have realized that, we don't look at the moon as a way. Only fishermen and farmers. We've lost a little bit of that ike and that mana'o and how to utilize the moon for our daily life outside of fishing and farming. Next slide, please. Another thing that we teach our haumana, which we're actually doing tomorrow, is ohe kapala. Again, it gives them a break. One of the things that we found out within a lot of therapy programs, culturally based therapy programs, is one of the things that they need after they finish a program is a means to make money, right? A means to make a living. And how to do that with low cost. So we teach them ohe kapala. We teach them the practice of ohe kapala. And what we do with that first is it's another way Hawaiians and other native cultures created designs to print on kapa or material to identify themselves. A lot of them never had an identity. And so what we do is we teach them to create a honua or their world through through these designs. And a lot of them have started to print their own T-shirts, print their own clothing, which gives them a means and a skill. You know, a lot of times I get haumana and they said, oh, you know, they've learned how to build a traditional hale. They've learned how to plant kalo, which is great. But at the end of the day, sometimes they don't have a space to build that traditional hale. They don't have the means to do it. Ohikapala is one way that's very simple that we can teach them a skill and a way to be self-reliant. Next slide, please. These are some of the examples of what they've created. We teach them to use their creative side of their brain to create their honua. So if you see the first one on the far left, you know, this represented this person. Their source of light and their source of mana came from the sun. All those green spirals represented his brothers and sisters. He's an ocean person, so represented by the ocean. And the bottom triangles, the pavehe design, is his parents and his on both sides. They're the foundation of who he is. So they create this pattern. And what they do is a lot of times they take this pattern and it becomes a keepsake. It becomes now, as I tell them, you are now the keeper of your family's knowledge. And of course, you have to give them examples of how to sustain themselves and how we can use Ohikapala, because a lot of them say, well, I just do these designs. What is it for now? So we show them that if you go online right now, people are selling these things. Next slide, please. So to kind of wrap things up, and I know I jumped through it. It's really difficult, and I'll be honest, it's difficult to talk cultural practices via a computer screen. I would highly suggest, I would love for you folks to come visit us here at Waianae Coast Comprehensive so you can actually see, and we all know as cultural practitioners, to see, touch, feel, hear, and be involved is one way. But I leave you with this, by doing things Hawaiian. Now, whether you're a Hawaiian or not, I want you to use, when I say Hawaiian, I want you to put your ethnicity in there. By doing things Hawaiian, you begin to understand how our Hawaiian ancestors worked and thought, and you gain appreciation for our native traditions and indigenous practices. With that said, I highly, highly encourage all of you to seek out and create relationships with the Western medical world. It's only going to empower us. It's only going to move us forward. Adding to this, over time in the last 5 years, we started this program as a Native Hawaiian-based program just because of the fact that that's the cultural practice that I've learned was Native Hawaiian. Over time, we realized that in our classes, in our haumana, we have got poe haole, we've got poe Japanese, we've got Korean, we've got popolo, we've got every ethnicity and every culture, even social cultures. We have the Mahu culture. We have so many different social cultures, ethnic cultures in our programs. So what we do is we created a culturally based program. For example, we had a Filipino haumana, and he was having a little bit hard time to understand what we were teaching. And he says, well, none of this relates to me because I'm not a Hawaiian. I said, okay. I said, well, I'm going to challenge you as a Filipino. What is the Filipino word and the concept for vahipana, for sacred places? What is your connection to where you are from? And then you see this light bulb go off. Oh, I get it. So a lot of our different cultures, people will question, well, why are you using Native Hawaiian culture? I encourage each and every one of you to look at your own culture and look at your haumana's culture and figure out how you can make it relative. The 4 things we look at: it's got to be relative, it's got to be informational, it's got to be intriguing, and it's got to be entertaining. Without those 4, you're not going to really have that audience and really help them. So I know we totally went through this and threw it all at you. But if you have any questions, we'd love to answer any questions. There's so much more to our culturally based program. And keep this in mind. A lot of people ask, Do you teach culture? I say this. I don't teach culture. I'm not a culture educator. I don't teach culture. I use culture to teach, if that makes sense. But with that said, mahalo, mahalo, mahalo. I encourage each and every one of you to look into your cultural background, your ethnic background, your social background, and figure out how to make and empower our ohana in this time of need.
Mahalo nui. That was amazing. Mahalo nui to both of you. Yeah, I was like, can I come out and see you guys? I would really love to. And yeah, mahalo nui. That's just amazing. The turnaround in the numbers, incredible. The work that you folks are doing out there is just phenomenal. So mahalo nui to both of you for everything that
We
you're doing. I
we
would love to have
totally
you back.
yeah, let's
Go
do it.
ahead.
We totally encourage all of you. I mean, this is a time for us to hui poo. And I always say this, and I want to leave also another Ike bomb, as I call it. Sometimes in cultural practices, as of late, it's really cool. It's the cool thing to do. It's a novelty. But we have to pass that. As I say, we have to indigenize the colonizer with as much passion as they colonized us. We have to tell them, we have to force feed them sometimes. What we do works.
Yeah. Yeah. Absolutely. That's just mahalo nui. I think I wanna have you guys back to do your more detailed one.
We've been really, really blessed, and we've been really, really lucky that we've been able to slowly, on the Western world of medical providing and addiction therapy that they're looking at us. We've been invited to some really great ones, but I'll tell you right now, I think I can speak for Dr. Wright as well, is that we are really, really humbled and privileged to share here at home, here at home. And not to be a thorn in the side, but I want to share a few downsides to what we do, and which is very important. A few of the downsides is this. I grew up and I learned traditional Hawaiian healing from very traditional kupuna, my grandparents and others. I'll be honest, they did not like what I'm doing. They do not like what I'm doing. Cultural practitioners should stay and work with the native Hawaiian and basically stay in your lane. We can't do that. When did we stop? Ask yourself, when did we stop creating tradition? We are doing cultural practices that are 1,000 years old. In 1,000 years, everybody on this Zoom is going to be a tradition. What do we create to move forward? So there's going to be a time, and I'll be honest, there's a lot of people that don't like the concepts that I use. They don't like the fact that I work in a Western clinic. So I challenge yourself. At one time, I'll be honest, I was stuck between a cultural rock and a traditional hard place. So you have to make that decision. And I made the decision, and I'll be honest with you, the decision was really difficult because I had to walk away from a lot of my kumu and a lot of my kupuna to do this work. It's difficult. So something to think about. Aoi pauka ike, right? Not all knowledge is taught in one school, but also at the same time, it takes a village. So let's hui pu. Let's put all of our minds together. Whether you're a native Hawaiian or not, there's going to be some difficulties. But if not for people like Dr. Wright, the late great Dr. Engel, and a handful of medical providers seeking out cultural practitioners, our numbers would not have happened. Our successes would not have happened.
Mahalo for sharing that. It's important to take note of. I think, especially as we're doing these this work culturally and are looking at utilizing our practices in these ways. Mahalo for sharing your truth and for doing what you are doing.
Yeah,
Yeah.
we as soon as you do anything cultural, we know we are automatically put under a cultural microscope.
Yeah.
We become studied, right? So holomua.
Yep. Very true. Very true. Mahalo. We had a couple questions come in. Before I get to those, I just want to say, just recognizing the time, and for anyone who has to jump off, we did put the survey link in the chat, and if you could take 10 to 15 minutes to complete that survey for us so we can know what worked for you, what didn't. Also, that helps us keep going and keep choosing new topics as well. It also, you'll be entered into a raffle to win a $25 gift card. And then there's another link in the chat as well for if you need continuing education credit, you can go ahead and fill that out. We'll send that in the follow-up email as well, but just so you know that. Someone also asked if the webinar will be posted. It will be on our Ohana Center of Excellence website, which is AA. For some reason, I can't write in the chat. I can only talk to everyone who's who's a panelist, but it will be on our website, aanhpi-ohana, ohana.org. Oh, let me just show it on the screen real quick. Maybe Craig, if you could put that. Thank you so much. You're the greatest. So if you go on our website, go to the Learn area at the top, and then just click Replays, and then you can see all of our recorded content there. And so it'll be up in a few days. And then so the questions that came in, I think there was one about how do you define relapse? How do you define relapse? Is it by the amount of time before returning to drug use?
Yeah, that's a great question. So relapse, we just define as anytime somebody goes back to using a mood-altering substance, including alcohol, after they complete a program. We know that that substance use disorders are a medical condition, and right now we do not have a cure. So anytime somebody uses a mood-altering substance after they've established a period of sobriety, that is how we define relapse. And there are some small nuances that have definitions for the difference between a relapse and a lapse, but that's how our program defines relapse. Thank you.
Mahalo. And then the other question was, is health insurance coverage mostly Medicaid?
Our program only takes Medicaid insurance. I know that sounds really weird. So we don't currently take commercial insurance. Somebody can choose to cash pay for our services, or if they have Medicare or they have insurance that we don't take, we also have several state contracts that can help subsidize the cost of insurance, of treatment.
Okay. Awesome. Mahalo. Does anyone else have any final questions that they want to ask? Besides, can we all go out there and take a tour? Because I'm pretty sure that's everyone's request.
Anytime you folks want to. I have to tell you that earlier slide that you guys saw of Waianae Coast Comprehensive, if you've ever been here, one of our biggest projects when I first came on was to utilize the space. So we have about 3 or 4 miles of walking trails and gardens and sanctuaries. We've got over 150 laulapa'au on property. The goal was, if we are a health center and we service Native Hawaiians or anybody of Native culture, why are we not using our land to heal ourselves? So we invite you to come out, utilize the space. I'll just put it out there. If you were as a provider in another organization, utilize our space. We've got everything up here. There's nothing more exciting than sitting with a haumana or a client or a patient in an open space and letting the environment heal them, and we just be there to help.
That's beautiful. It's beautiful. Mahalo.
For sure. Kalamayao, 10 minutes over.
That's okay. I would just stay here and talk to you guys forever.
I wish. Just get in touch with us any way possible.
Awesome. Mahalo nui to both of you for sharing and for everything that you do for the community. And yes, we will be sending everyone those links following up after the Zoom. Please reach out to us also if you folks have any questions or if you have any requests or if anybody wants to follow up to this webinar, please let us know so that we can make that happen. And mahalo nui. Everyone have a great rest of your day.
Yeah. Ohiho.
Ahuiho.